इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है, नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स, अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Good morning, Apollo family. PCOD or polycystic ovary disease is something that is affecting a large number of young girls and young women in our country. As a mother of a young girl, I understand how difficult it is to manage. So let's talk about it in today's episode of Apollo 24/7's Health Hour. Let's understand all the signs and symptoms right from obesity, weight gain, unwanted hair, irregular periods and fertility issues due to PCOD. Joining us in today's episode is Apollo's expert gynecologist, Dr. Mithee Bhanot, who is going to answer all your questions in the live session. So join us and ask your questions at 11 a.m. today.
It's always been there, standing between you and your health. A wall between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show which is devised to get you Apollo's expert right at your doorstep, right at your convenience of your home. Here we bring you an Apollo's expert every week where you can ask questions on this live show. Today we are going to talk about PCOD, polycystic ovary disease, and we are bringing you Apollo Senior Consultant Gynecologist from Apollo Hospital Noida. Dr. Mithee Bhanot is going to join us very shortly. So get your questions coming up on the screen. You can please type your questions only on YouTube chat, wherever that you're watching this show on. But I request, if you want to ask a question and get answer from our expert, I request you to please type it only in the YouTube chat. Such questions I'll be able to take. And whenever you're asking a question, please do mention age and history, whatever gender, everything in one question. That will help me to scout through your questions better rather than splitting your question. Thank you so much, all of you, for joining us on this Sunday morning. Shortly, we'll be joined by Dr. Mithee Bhanot. And before we start, let me urge you to download Apollo 24/7 app, which brings you entire Apollo's expertise just to your palm. All right, and there's a wonderful initiative which is being promoted by Apollo 24/7, Sachi, that is Saving a Child's Health Initiative. Apollo Foundation, in association with Apollo 24/7, is on a mission to make quality healthcare accessible to underprivileged children at no cost. That means अगर कोई बच्चे आपके आजू बाजू हैं जिनको free pediatric consultation की ज़रूरत है, more than 10 plus pediatric specialties from Apollo hospitals who are renowned pediatricians from Apollo, they are benefiting children across India. Scan the QR code to know more about this initiative and spread the good word. Alright, आज के टॉपिक के बारे में बात करेंगे PCOD. This is polycystic ovary disease, which can affect more than 20% of women population. So let's understand how to manage and what are the myths around it. Joining us is Dr. Mithee Bhanot, Senior Consultant Gynecologist at Apollo Hospitals Noida, who's more than 20 years plus experience in the field, and Association of Obstetricians and Gynecologists of Delhi के life member है. Noida Obstetrics and Gynaecological Society के life member है, and also she's a life member of FOGSI, member of RCOG London, UK. She's published in various national and international journals as well. So we present you Dr. Mithee Bhanot. Good morning, ma'am. Welcome to the show.
Good morning. Namaste.
Namaste, ma'am. So we हाल ही में कल, we have yesterday 28th of May, we have celebrated International Day of Women's Health Awareness Day. So that also says a lot that women's health is not given enough priority, and only when they require gynecological help or delivery ke help pe aate hain. Is that what you also see, or is there a change in the pattern, ma'am?
No, this is what we've been seeing over the years, that women tend to suffer and keep suffering from the same problem for years and years, and only when they reach a certain stage, they are, yes, the kids have cleared the school, they are settled, then they find time for themselves in their 40s, and then they come to us for chronic problems. So this is one trend which we have been seeing, although the younger generation is quite smart and coming to us quickly.
Right. So now coming to today's topic, which is polycystic ovary disease, I was looking at the facts which say 20% of young population, young women are affected by polycystic ovary disease. And why is it so? Can you please tell us what polycystic ovary disease on the onset is, and how does it affect young girls?
Yeah. So, polycystic ovarian disease nowadays is just like a lifestyle disease, and the incidence being between 2 to 26 in 100, right? And a lot of it goes to our lifestyle, our sedentary living, and the diet which we are consuming. The more processed food and all that, all taken into account, leads to an increased incidence of polycystic ovarian disease. The causes and all, we'll further discuss it later on, as and when we get the questions.
Right. So what age group can be affected by this, ma'am?
So the age group could be as early as teenagers, all the way down to around 45, 60, till the time you attain menopause, depending upon the symptoms which you have and the complaints which you have.
Right. So this is like a wide age range, ka bhi wide range hai.
Yes.
So all over the
Yes.
fertile period of a woman, they can be affected. Right. So, what are the
Yes.
symptoms that one can be categorized as a polycystic ovarian disease?
All right. So when when a lady comes to us with complaints like irregular cycles, delayed periods, scanty flow during periods, or difficulty in getting pregnant, or weight gain, or difficulty in losing weight. So these are the patients which prompt us to look towards polycystic ovarian disease.
Right, right. So, and these can be from other ailments or other issues also, no ma'am. Something like thyroid अगर किसी का है तो उनको भी metabolism और weight gain के issues होते हैं तो उनके
Yes.
भी
So these are
होते
some.
हैं. How do we differentiate?
So there are certain tests available, and we take a detailed history of the patient, and then we go around performing some hormonal tests and an ultrasound, and when we correlate all the three together, we rule out the other causes, and then take polycystic ovarian disease into account as the cause of the symptoms.
Done. So investigations are a must. Once we understand that we are going through certain symptoms as body signal there, that's when you go and get an investigation done. When does one need to
Yes.
consult a gynecologist, ma'am?
So when the symptoms start affecting the quality of life, and you start changing the day-to-day living because of the problems which you are having, like your periods are getting delayed and you're really stressed about it. There is weight gain, which according to you feel is not normal. There are certain people who do understand, yes, I'm gaining weight because of lack of exercise, but despite exercising, despite taking a good diet, if there is a weight gain, yes, you do need to consult your treating doctor.
Right. So understand that there's a pattern which is normal to your body, and then there's a pattern which you're not able to break. That means having awareness and taking that call for health, women's health, is very important. And right time पे भी पहुंचना चाहिए. And Apollo 24/7 actually makes it easier to consult experts like you, ma'am, especially a gynecologist can be, then you might call them for an investigation in the clinic.
Yes, yes. That is the time
Okay.
we, examine the patient completely and then offer them the investigations.
Great. So treatment के protocols क्या होते हैं and how long does one require to have a treatment?
See, polycystic at the end of the day cannot be treated. It can only be controlled, right?
Oh, really?
So for controlling, yes, it cannot be treated. We can keep it under control and it can be controlled for years together. So depending upon the symptom, what the patient has, we offer different treatment modalities. And the crux of the treatment is your lifestyle changes, which you need to bring in your daily life. That is the crux of the treatment. And then depending upon the symptoms, we offer them medications, tests, and further treatment.
Great. Here's an interesting question. A lot of people are asking questions, ma'am. Mr. Suresh Joshi is asking, how do we manage irregular periods due to PCOS for a 17-year-old girl? Now, before you answer Mr. Suresh Joshi's question, I would want you to give some clarity on PCOD and PCOS.
Okay. So polycystic ovarian disease, that is PCOD, mainly concerns the symptoms of irregular or delayed cycles, facial hair on your, excessive facial hair, that is signs of increased male hormone in your body, and plus ultrasound features of polycystic ovaries. Polycystic ovaries means the size of the ovaries are slightly bigger, and there have some they have some peripheral fluid filled cystic areas. So that's a typical ultrasound feature of polycystic ovarian, and combination of these is called polycystic ovarian disease. But as we age further, people who are not able to control polycystic ovarian disease end in a syndrome which is called polycystic ovarian syndrome, which is a combination of PCOD plus the metabolic changes like precursions to diabetes, hypertension, increased lipids, hyperlipidemia, and these are all a combination of lifestyle, and they together form the PCOS, that is polycystic ovarian syndrome.
Acha. So now coming to Mr. Suresh Joshi's question, how do we manage irregular periods due to PCOS in a 17-year-old girl?
All right. So for a 17-year-old girl, first and the foremost treatment which we offer is a strict exercise regime and a through of a diet, so that we expect that she should be on a very healthy, balanced diet, less of processed food, more of greens and fresh food. So that is our first step. Now, in case after following the regular diet regime and the exercise schedule, even then, if she is having some irregular cycles, then we put her on a treatment, a short treatment of hormones. Give her a trial for 3 to 6 months, and we further ask her to increase the exercise duration and all. And towards the end of 6 months, with the exercise and with the diet changes, along with some help from our medications, the cycles should be under control.
Great. So just for my understanding, ma'am, अगर ये PCOS के बारे में हम बात करते हैं, if some आजकल के बच्चे तो early menarche में आ जाते हैं, they start their puberty years very early, as in 10 and 11 में भी बच्चे first period आ जाता है. So how do we understand irregular periods? Period cycle settle होने की वजह से आ रहे हैं या PCOS की वजह से आ रहे हैं? How do we understand?
See, जैसे ही menarche शुरू होता है, that means the first period which a girl gets. So from that period, for the next 3-4 years, the cycles are irregular. We have a immature axis. So it takes the body 3 to 4 years for the cycles to get regularized. The importance here is that we don't offer them any treatment, but yes,
Okay.
the little girls should be advised that you must play regularly, right? And this is the time, we tell them to stay off from, not completely off, but yes, reduce the chips, the cheese, and the pizzas and the junk food less. And we just counsel them that yes, it would take 3 to 4 years for you to regularize your periods. So don't get stressed about it. You don't need any treatment. Yes, regular exercise and diet.
ग्रेट. तो समथिंग रिलेटेड टू दिस, मंजू जी पूछ रहे हैं, मंजू कुशवाहा पूछ रहे हैं, हेलो मैम, मेरी बेटी 13+ है, उसके पीरियड हमेशा लेट आते हैं. 12 साल की थी जब उनके पीरियड शुरू हुए थे, पर कभी कभी मैंने जंप करके आता है, प्लीज हेल्प मी.
मंजू जी, ये बिल्कुल नॉर्मल है पीरियड शुरू होने के 3-4 साल तक, दैट यू गेट डिलेड साइकिल या 1-2 महीना स्किप हो जाना, ये बिल्कुल नॉर्मल है. तो इसको घबराने की बात नहीं है. बस ये ध्यान रखिएगा कि आपकी बेटी सिर्फ पढ़ाई ना करती रहे, खेलने कूदना, खेले भी बहुत जरूरी है. कम से कम 1 घंटा रोज शाम में खेलने के लिए बाहर जाएं, एंड दैट शुड बी सम फिजिकल वर्क, एंड दैट इज इम्पोर्टेंट. और ये जो 1-2 महीना स्किप होता है, इट शुड सेटल डाउन इन 3 to 4 years.
सो ये पहले इनिशियली सबका होता है मैम, और इज इट ओनली इन सर्टेन चिल्ड्रन?
No, it is quite a common thing, whether you have polycystic ovaries or you do not have. It is quite a common scenario that for the first 2-3 years, you may have irregular cycles. And that's normal.
Great.
That's perfectly normal.
Yeah. So next question is something that I think most women would want to know an answer for, and everybody experiences this. Shavya Nagila is asking, ma'am, how to get periods on time with lifestyle changes, and how to deal with extreme mood swings during periods and PMS?
All right. So to answer your first part, how to get regular periods with lifestyle changes, the first is that choose a time according to your convenience for your exercise regime, right? A fixed duration and a fixed time. And then no matter what, whether you have a movie ticket booked or you have to go out for an evening, that fixed hour should not change, and you should be on a very strict exercise regime. Follow that. If you're really thorough with it, and if you really stick to it, that really helps in around 70 to 80% of the patients to really regularize your cycle. The second tip being that reduce your processed food, and as far as possible stick to fresh, homemade, local cuisine and the local food. That really also helps in regularizing the cycles.
Wonderful.
Coming to
So
the mood
ये
swings,
extreme mood swings.
yes. Coming to the mood swings, you do need a very good support of your family around you. That is one. And in 70 to 80% of the patients, you yourself are responsible for your mood swings. So if you decide that, look, I need to be happy, think about the things which do make you happy, whether it is talking to your friends, going out for an evening. These little changes do help you in improving your mood. But despite that, if you feel that no, these swings are really affecting your quality of life, it is time to consult a specialist then.
Thank you so much, ma'am. And I also have observed if I'm exercising well in my PMS, my mood swings are much better than what they are when I'm not exercising. Is that also true,
Of
ma'am? Is that
course,
a factor?
that is really true that if you are following your exercise regime, 70 to 80% of the patients are comfortable and do not require any pharmacological treatment, any hormonal treatment whatsoever. Just by lifestyle, our mood swings, our problems in polycystic ovaries are well under control.
Wonderful, ma'am. So, next question is from Ms. Astha Kumari. My name is Astha and I'm 17-year-old, suffering from irregular periods. Sometimes it's been 6 months with no period, and it's normal for me to have periods after 4 to 5 months. Is this normal, ma'am?
So, for people having irregular periods, we say that you must have at least 4 periods in a year, right? So if you're having 4 periods in a year, that's good enough. But if less than that, like Astha is saying, she has it after 6 months, then she does require some medical treatment, some hormonal treatment to regularize the periods. These are the patients that do need help, medicines, that so that they get regular periods, and one medicines, they take care of the lifestyle changes, and gradually, as they are comfortable with their lifestyle changes, we start reducing the medication dose, the hormonal dose which is offered to them.
Great. Next question is Miss Aruna Mahesh. Aruna is 32-year-old. Is PCOD curable or permanent? Are there any food restrictions? How to deal with PCOD to have pregnancy? I think this is one important question, ma'am. As young girls, we'll advise them to have good food, lifestyle changes. But once they get into this fertile bracket, pregnancy becomes an issue. And how do you want to address this issue, ma'am?
All right. So the first thing is polycystic ovarian or PCO is controlled. It is not treated, right? We control the disease and take care of the symptoms, take them one by one, and we control them. That is the
Yes.
first. It is not a permanent thing. You can easily get over it, and as you change your lifestyle, the things are under control, well under control. Yes, it does cause difficulty in conceiving, but that is only in 20 to 30% of the patients. And a
Acha.
major trick in these patients is weight loss. Even if you manage to reduce a 5% weight loss of your body weight, it increases the conception rate really high. A
Acha.
5% weight loss also you increase your conception rate. And yes, for those who still are not able to conceive, then we offer them some medicines which help in improving the quality of eggs and the number of eggs, and then ultimately help them in conceiving as and when required.
Great. Nida Manzoor is asking the next question. Nida is 22-year-old. I have irregular periods since last 5 years. I underwent many treatments, including Ayurveda, but I have not felt long-lasting relief. What should I do for managing my PCOD?
All right. So, firstly, Nida, I would advise you is stick to one regime. Don't make a cocktail of treatment of Ayurveda with homeopathy, with allopathy, and all that. So, have faith in your treating doctor and stick to one regime. And along with the treatment, what you need is a good lifestyle change. And if you're not having the results with your treatment, go back to your doctor. We have a lot of medications, we have a lot of combinations of hormones. A set of treatment for one patient may not suit the other patient, right? So we
Correct.
have a whole lot of treatment which we could offer. There is a basket of treatment. And then if you're not getting affected by one therapy, we can offer you the other set of therapies. But the advice is just stick to one regime rather than mixing, all the other modalities of treatment.
Great. So while we're talking about Nida, एक और बात मैंने देखा है, a lot of women tend to stop their treatment, especially when they are prescribed certain hormonal medications for a longer duration. उनके मन में ये आता है, especially I've seen younger children's parents getting affected by, oh, this is contraceptive. Why is this being given to my child? How can this be treatment? So these are all myths around PCOD treatment. How would you want to bust them?
So, see, at the end of the day, oral contraceptive pills are also hormones, right? And like any other hormone, the oral contraceptive pills, other than offering contraception, also helping the other hormonal like irregular periods, and delayed cycles and all. So don't just take the, for especially for parents of young girls, it should not be taken as that, no, my child has been given, my daughter has been given oral contraceptive pills. At the end of the day, they are just hormones, a specific combination of hormones which are offered for irregular cycles or, delayed periods and all. And they do, the treatment finishes over a period of time. So it's nothing, there is no myth or there is no stigma attached to oral contraceptive pills. In fact, they are a very good treatment modality to control delayed cycles or irregular cycles.
Great. So next question is Hina Pandya. Ma'am, I'm 28-year-old. I don't know if I have PCOS or PCOD, but I have seen all the symptoms that you've mentioned. I have period regularly last 3 to 4 years, but flow is very low. Please suggest what I can do.
All right. So there are some people who may have regular cycles but scanty flow. So if it is just scanty flow, it is all right. But if it is associated with weight gain or certain mood swings, then it is the time that you, yes, consult your doctor. There are certain hormones which could also cause this, like imbalance of the thyroid hormone or the prolactin hormone, which could lead to, scanty flow. We would check for them and then probably offer you an ultrasound to rule out any other cause like any cyst in the ovary or any other cause of scanty bleeding. So if these things are normal, then yes, just the lifestyle changes should be suitable for you.
Great. So Shweta's question is next, actually leading to the cyst wala question, that information that you passed. She has an ovarian cyst. Now it is 15 centimeters. What are the treatment options available for her?
All right. So a 15 centimeter ovarian cyst is a very, very big mass. And the current guidelines tell us that anything above 8 centimeters, 8 to 10 centimeters should be offered treatment. So, I don't know her age.
Is surgical?
For a 15 centimeter, yes, very difficult to individualize, but yes, we would offer a surgical treatment that could be through laparoscopy. But then also depending upon the type of the cyst, just an ovarian cyst is not the answer. There are various causes for the ovarian cyst which need to be ruled out first before offering her any other surgical treatment.
Great. So, but there are treatments available and one should not wait or hesitate to reach out to a gynecologist.
Of course. You should not wait for your cyst to grow till 15 centimeters and you must meet the doctor earlier.
Another question with the same thing. What will happen if somebody is not getting the treatment, right treatment, or not actually consulting a doctor for treatment? What can this lead to?
So for polycystic ovaries, PCOD, if you're not taking the treatment, then as you age, depending upon, your age and your complaints, the symptoms get worse. So for irregular cycles, they could further be related to increase in the male hormones of your body, which could lead to hair growth on their facial features, excessive hair on the face. And then irregular cycles could lead to further weight gain, which is very difficult to reduce then, right? And difficulty in conceiving. That is one major thing. And if you do conceive also, then the chances of miscarriages would be higher in such patients. So it is always
Right.
better to take timely treatment. Yes.
Wonderful. So, next question is Meenal. Meenal Shah is 35-year-old. She's been diagnosed with PCOD only 4-5 years back. But though I started getting skin patches since my first period, right now I am unable to lose my weight despite strict diet. I do not understand the skin patches here. Is it related to PCOD, ma'am?
Yes, some people have skin pigmentations around the nape of the neck and the back of the neck, and that is also a symptom of polycystic ovarian disease and related to the insulin hormone resistance. So this is a
Okay.
common symptom seen in polycystic ovarian disease, and only diet restrictions would not help in weight reduction. You need to be on an exercise regime also, and despite that, if you're not able to reduce the weight, then yes, you do need to consult your treating doctor, and we would be offering you a hormonal profile and then offering you treatments on hormones according to the test results. And
Yes.
sooner or later, you do lose weight.
Great. So, Minalja, you can consult Dr. Mithee Bhanot on Apollo 24/7 and take it further. The Prachi's Kitchen. Prachi is asking, I have regular periods, but I 15 days is my menstrual cycle. Is this normal?
No, 15 days is not normal. We need at least 21 days break for us to call it a normal cycle. So, if you are having a 15-day cycle, yes, you do need to consult your doctor. We would like to rule out the other causes of, short cycles in females. We would offer you an ultrasound and look for some organic causes or some hormonal issues which could lead to smaller cycles.
Okay. So, Vandana Verma ji, who's 24-year-old and suffering from irregular period and PCOS, I think we've been talking about a lot of them in that age bracket, 24, 22 के age bracket में. I would want to understand how long, what kind of stress does this PCOD put women through, and these long periods of PCOD. I have seen my very own sister-in-law who's struggling with hair loss, hirsutism, extra growth of hair on chin and other places. She's been struggling to lose weight while she's being managing, and she finds it quite stressful doing this for years together.
So one of the basic problem with polycystic ovarian is that people leave the lifestyle changes in between. They would do their exercise for 3 months, 6 months, and see no results, and then they stop and they go back to the sedentary lifestyle, which is not a good thing. So for any change or any stress free, you have to be regular with your lifestyle changes and take it. You have to imbibe it in yourself. That is the first. The second is the young girls, appearance is very important for them of all age
Correct.
groups. But yes, in the younger age group, this takes a stance. And the changes associated with polycystic, like hair growth on the face or weight gain, they do affect and cause a lot of stress in these young girls. So for them, it is really required that they come to us timely. They come to us at a time, not when it is too late and it takes them too much of time to cure them of their problem. They come to us and take timely help, and we can really treat these changes and the hair growth and all with the treatment offered and the hormones present. So it's not a very major problem, but the crux is that you need to come to us at an early stage. That is very important.
Perfect. Very well answered. Ma'am, Priyanka Singh's next question. Hello, doctor. I am from Kolkata, 30-year-old, diagnosed with cysts in both ovaries, more than 10 cysts in both ovaries. My periods are very painful, means a deadly pain. Please suggest.
All right. So cysts in both ovaries, do you mean to say that she has polycystic ovaries, or there are 10 centimeter cysts in both the ovaries? So in case they are polycystic ovaries, yes, we could put you on oral contraceptive pills or other modes of hormones which could offer you pain relief. But if there are big cysts, 10 centimeter each on both sides, you would need proper examinations, and probably medical or surgical treatment could be offered to you.
Great. So that means there are two things that we're looking at. Polycystic is different, and having one singular cyst or one or two cysts which are large in size are different. These are two different
Of,
causes and reasons.
of course, of course, of course. In polycystic, there are very, very small, cysts around in the periphery of the ovary, arranged like a necklace, right? They're very small cysts arranged. But people who have ovarian cysts, they have one or two big ovarian cysts, and they could have many causes for that. There could be different causes for those big ovarian cysts, which are very different from polycystic ovarian diseases.
And just one more thing that I think it's for my information and also for the audience's information. How much do my genetics play a role here? Is this hereditary or is it just a lifestyle issue?
Well, it could be hereditary, right? And that is seen in patients, and that is seen in the ladies. Yes, it could be hereditary, but more of a lifestyle disease also, mostly
Okay.
lifestyle.
Done. Well, I don't have the name of the person here. It says story time. Hello, ma'am. I have PCOS and I took Femilon for 3 months. But 1 or 2 months, my period came regular. But now again, my periods are 48 days late.
All right. So, Femilon is a very good method for treatment for polycystic ovarian disease. But before stopping, you should be very sure that, yes, I am actually controlling my disease with my exercise and lifestyle. So, after you stop Femilon, if you don't exercise, you will be back to square one. So, that is important. And do not stop the medication without consulting your doctor. Let her
Ma'am,
ask you to stop it in a better manner.
this is something that I want you to stress again and reiterate again and again, because I have seen family members going through this, giving up treatment in between, saying that I'm fine, and then going back to square one and coming back to the problem again. So it should always be in consultation with a doctor. Never judge your symptom, is what I have learned in my experience,
Yes.
especially
And
the
the thing is,
hormonal.
yes, the thing is, these medicines help us. They really help in treating the problem. But at the end of the day, you can only control your polycystic ovaries with exercise. So when you start taking the medicines, you think my symptoms are under control, so you stop exercising, which is the danger sign, and then you go back to where you started. So the most important thing is we taper the medicines gradually, making sure that you are following that exercise regime. And once we are sure that, yes, you have made the adequate lifestyle changes, that is the time we stop the treatment and watch you, right? And most of the people do improve.
Great. So here's next question. Sumit Verma's wife is 31, withdrawal bleeding hair, and AMH is 22. Doctor also has said about PCOD. We are trying for a child. Few months follicle was observed, but last month egg did not rupture. So this is the next phase of a PCOD and pregnancy. How does one understand this, ma'am?
All right. So, for patients with polycystic ovaries, some of them, 20 to 30%, may find difficulty in conceiving, for which
I think we've lost doctor's connection here. We will wait for her to refresh her link and join us back, because this is an online platform. Doctors joined in from Delhi. Ma'am, I think we will have to repeat the question if you are there. If you can hear me well, if you can refresh the link and join us, that will be helpful. A lot of questions today I see that men are asking about women's health. I'm glad that, ma'am, can you hear my voice? Dr. Mithee Bhanot's picture is frozen on the screen. We will wait for her to log in back or refresh the link and come in again. Yeah, while I'm looking at the questions, a lot of men are also talking about women and women health. As yesterday we've observed International Day of Action for Women's Health, I urge all the men to understand this. And this is not just a women's issue, this is not just a segment's issue, this is about the entire society's health. If you have a child who's facing this issue, if you have a sister, if you have a mother, if you have a wife, and I think we're back on the track. I
Yes,
hope,
yes.
sorry for the trouble that we had a slight technical difficulty. We got Dr. Mithee Bhanot. Yeah. Dr. Mithee, yes, we are talking about pregnancy and difficulties, follicle issues. I'll continue. Would you want to continue with that answer, ma'am? Because there wasn't, we couldn't hear the answer
Yes.
properly.
Yes. Yes. So, for people who find difficulty in conceiving, it is basically with the ovulation or the egg production. So, we do offer them medicines which are ovulation inducing medicines, which improve the quality and the number of eggs, right? Done in normal with any of the gynecologists. But despite that, if there is difficulty in conceiving, then yes, we do offer them IVF later on, right? But good 60 to 70% of the polycystic patients do conceive with just a little help from the normal, general gynecologist treatment. Very few need to go for the IVF.
So, Sumit please be positive and please be happy there. Right. Next question is it Gaurav Modi? Ma'am, is it normal to have no dominant follicle in a cycle?
Yes, we have 12 cycles in a month, and in them, one or two may not have any dominant follicle, and that is absolutely normal and physiological.
Yeah. Aishani is asking this question, 28-year-old, irregular periods post pandemic for 2 years almost, and now that irregular periods have subsided, I'm on my regular periods. Does that mean my PCOS is managed?
Could indicate that yes, it is well under control, right? And if you are making that good exercise and lifestyle changes, you can keep it controlled for years together without any worries.
Done. Muthu Bharati is asking, how does ovulation induction therapy help in conception for patients with PCOD?
All right. So, like I said earlier, ovulation induction help in improving the quality of the eggs and the number of the eggs. And that is an issue with the polycystic ovarian patients. So, with these two under control, the conception rate is higher than without the medication in around 50 to 60% patients.
Great, ma'am. Rajkumari is asking, I have had my cycle time controlled once, 30 to 37 days. I've started undergoing treatment for facial hair reduction. The cycles are not regular now. Can the treatment be a reason?
So depending upon what treatment you're taking for your facial hair control, right? If it is some hormones, then yes, your cycle should be under control. But you do need to take these treatment under the guidance of your gynecologist and not on your own. And even if you're going to the dermatologist, you must tell them that you are having polycystic ovarian disease. So they give you the treatment which helps you in both for facial hair reduction as well as regularization of the cycle.
Great. Ankita Sharma Rajak is asking, ma'am, what is estrogen hypersensitivity? What are the symptoms and treatment? Is this a completely different subject, ma'am?
Yeah, this is not related to your polycystic ovarian disease. Yes, estrogen hypersensitivity, it means that you are really having that increased female hormone in your body, which is a normal thing, right? But it is not related in your polycystic ovarian disease syndrome.
Okay, ma'am. Next question is Shivani. Shivani is suffering from PCOD for last 3 years and trying for pregnancy. I've taken all possible treatments, but of no use. Please help me. The same thing. A lot of people are asking about how should we stay. Vishakha Goel is asking how should we stay motivated during the whole process since weight loss is very slow. In my case, I've been struggling and could not lose weight at all. I'm 30. So now Subhadeep Das is also asking. I'm asking three questions which are related because we're running short of the time. And after consulting Dr. Subhadeep Das is taking Dronis 20, nearly 1 year of PCOS management. But one cycle she doesn't bleed at all. The next cycle she starts to bleed. So this is talking about a period of management. This is talking about a long-term management with medication. What happens if one loses motivation, one stops treatment, and no results are to be found after a period of treatment also? Definitely one goes into a stress, no ma'am?
Yes, they do. But then at the end of the day, you need to realize that if you take stress for it, you are further worsening your condition. Stress is another lifestyle thing which you need to reduce in your life. And like we say, karm karo phal ki chinta mat karo. Exactly. Keep exercising. That is the most important thing. Take your diet into account. Keep exercising. Be regular with it, no matter what. No matter what, be regular with it. And at the end of the day, you will see results. For some, it is 6 months. For some, it is 1 year. For some, it is 2 years. But at the end of the day, everybody sees results with these changes. Don't lose hope and do not stop. Do not abruptly stop. That is the main thing. You keep exercising, and with the medicines, if we just give medicines and we give medicines to a person who is exercising and regular with the changes, the medicines have a better effect if you are following the exercise, and they make better results. So that is important.
Exactly. So, ये 2 महीने का treatment नहीं है, ये 5 महीने का treatment नहीं है. This is going to continue as long as you are also supporting it with your lifestyle changes. Well, Vineet Sharma is asking, I've recently diagnosed with PCOS and my flow is not stopping since last 1 month. I've consulted a gynecologist and she gave me a medicine to stop bleeding. But each time this is continuing.
All right. So then we need then you need to get into your meet your gynecologist, and we would be offering you some tests to rule out some other causes also for continuous bleeding. Not everything is related to polycystic ovarian disease. There are some local causes for excessive bleeding, some things in the uterus, something in your womb which could lead to continuous bleeding, which need to be ruled out. So it is always better to go back to your treating doctor to find out the other causes.
ग्रेट नेक्स्ट क्वेश्चन है खाटवानी अमित जी से. हेलो मैम, 21 ईयर्स गर्ल के एक्सेस मेंसेस और मेंसेस भी 1 महीने तक चलता है और ब्लीडिंग हैवी होता है, और ये प्रॉब्लम उनको 4-5 साल से है और डॉक्टर को दिखाया फिर भी फर्क नहीं है.
ऐसा तो नहीं हो सकता कि डॉक्टर को दिखाएंगे और फर्क नहीं होगा. आपको अगर एक बार जाने से नहीं फर्क पड़ रहा, प्लीज गो बैक टू योर डॉक्टर अगेन. हम एक नहीं तो दूसरी मेडिसिन, दूसरी नहीं तो थर्ड मेडिसिन दे सकते हैं, एक ट्रीटमेंट प्रोफाइल नहीं तो दूसरा ऑफर कर सकते हैं. बट यस, ऑल दीज थिंग्स कैन बी टेकन इनटू कंट्रोल एंड दे कैन इजीली बी मैनेज्ड. So go back, have faith in your doctor, and go back to the treating doctor. That is what I would like to advise you.
Yes, ma'am. Next question is thyroid and PCOD. Purva Prajapati's question. Ma'am, I have PCOD with thyroid and medication Tyronorm 75, metformin and oral contraceptives for 4 years. I'm still unable to lose my weight. Constant at 60. What should I be doing?
All right. So the good part is your weight is at least constant and you're not gaining weight. So take it as a motivation factor and keep continuing what you are doing. And sooner or later, you would start losing weight because you have quite a number of things which all lead to weight issues, right? Even the thyroid and the polycystic ovaries, they all lead to weight gain. So the good part is you're not gaining weight. You're just not able to lose it, which sooner or later you would. So keep working hard there.
Wonderful, ma'am. So while we talk about weight, I think it's important to talk about Sangeeta's question. Sangeeta is 21-year-old. What is lean PCOD? I have difficulty in gaining weight. I took OCPS for 3 months. This is also a case to observe. It's not about just weight gain and weight loss.
Yes. So nowadays what we are seeing, there is a concept of lean PCOD also, that people are very slim trim yet having these issues, right? Yet having these issues of irregular cycle and difficulty in gaining weight. But these also can be managed, and just because you lean doesn't mean that you don't need to follow the exercise or the diet changes. That is important, right? So you may not need to lose weight, but you do need to stay fit to keep your metabolism into control, and that is also important for you. And yes, there are always methods and treatment offered, the medicines offered for your symptoms as and when you get it. But the lifestyle changes, despite you being lean and thin, needs to be followed by you also.
At most of the times, I think it's easy to look down upon the symptoms and think that we are not. PCOS is something where weight you think is one of the most important factor, and you tend to miss identifying PCOS or PCOD, especially in
So
lean.
yes, lot of the patients, what they do is they take it for granted that because I have PCOD, I am going to gain weight and nothing can be done about it, right? So this is something which really, this thought process needs to change. And nothing is there which cannot be controlled and which cannot be managed. At the end of the day, we need to realize that only our lifestyle changes can curb all these and keep it under control. So that is the main and the most important point.
Done. There's a question which is not related to PCOD, but I think being a gynecologist, they're asking you here. Abhishek Gupta, wife, I think, has undergone a surgery of endometriosis in April 2022. I want to know what are the chances of the cyst formation again. In case same happens, what would be the time period? Yeah.
All right. So endometriosis is another condition in which despite you taking the surgical treatment, there are chances of recurrence, right? So to prevent these recurrence, you do need to be on a follow-up and probably on the treatment given to you by your gynecologist depending upon your symptoms and the conditions which you had earlier. If you want to have a child, we give you a different treatment. If you do not want to have further pregnancies, we offer you different treatment. But yes, there is always a chance of recurrence, and the time period cannot be confirmed. It could be anything between 3 months to 1 year to 5 years to 10 years. So to each his
Yeah.
own, and it is a very individualized response to endometriosis, cannot be generalized.
Right. I think Abhishek ji, आपका question answer हो गया है. The next question is, ma'am, Pranati Kovuru. What is bilateral ovaries, and are there any tips to prevent?
Bilateral ovaries just simply means that you have two ovaries, which is common in everybody. Everybody has two
Bilateral.
ovaries. Yeah, bilateral means two.
Right. So
So
that's common. Everybody has two ovaries.
that's the normal thing.
So that's not an issue.
Yes, that is the
All
normal
right.
thing. There's nothing wrong in it. There's no issue with it.
Done. Ma'am, here's Deepali Malhotra, who's asking about ultrasound. When should an ultrasound done to be find out if one has PCOD or PCOS? I mean, on which date of the period?
So, depending upon the symptoms, we offer you ultrasound, but usually in a general that just after you finish your periods, that is the time we offer the ultrasound for a normal general population. But then those who are planning to conceive, the ultrasound offered is just day 1 or day 2 of the cycles, to see the number of follicles and the development of the follicles. So the time at which the ultrasound depends upon your symptoms and your the complaint profile. That is how we offer you the ultrasounds.
Great. So that's important to know. What's the reason for you getting and which age bracket are you in? All right. And Astha's question I think we've already talked about, which is an important question, ma'am. JT is asking, do taking contraceptive pills for a long time or for periods would have side effects on a long run? A very common question that we
See,
come across.
every medicine does come with a share of side effects. But if you do need oral contraceptive pills, your doctor will put you on oral contraceptive pills, right? And usually, when you stop taking these oral contraceptive pills, the side effects also settle down, right? But there is no medicine on the earth which does not have a side effect. And we only give you the medicines if you will benefit from the medicines. So probably you are benefiting more than you having the side effects, and that's the reason you need to continue it.
So ये weigh करना चाहिए कौन सा balance है ज़्यादा है. Then Nish का question है, ma'am, what's the use of NAC in PCOS?
What is NAC? I would not be
sure,
knowing that. I mean,
Yeah,
never
I'm
heard
not
of
sure.
it. NAC.
Yeah. If you can type, that's fine. And so that's it, ma'am. I think we've answered most of the questions. Yes, can I take one last question, ma'am, with your permission?
Yeah, sure. Sure.
Which is not a PCOD question. Meenakshi Vaishnav says, ma'am, I'm 27-year-old. I have a polyp in uterus. Periods are very painful. Please suggest.
Yes. So for the polyp in uterus, what you need is a surgical treatment, and that is the cause of your painful menses. And on the removal of the polyp, yes, which is done through a telescope and no cut technique, your periods would be pain free.
All right. So Pihu Sharma के question के साथ I would want to finish this session. Pihu is taking lot medication from 6 years PCOD के लिए, regular periods के लिए, but from the month of February and I don't have periods yet. So how long does it take to act, ma'am?
So that depends on what medicine you've been given and what was the time frame you've been given for, right? And what is your age group. So usually we give you, the hormonal or the oral contraceptive pills are given for 21 days, or for the withdrawal bleeding, the bleeding is given for around 5 to 10 days, and you should respond in 14 days. If you still don't get your periods within 14 days of stopping the medication, it is time for you to go back to your doctor and to look for the further causes or any other cause for delayed period.
Yes, ma'am. Nish has come back with the answer. NAC is acetylcysteine tablets in PCOS?
All right, so those are the tablets. So these are certain chemical substances which do help us in regularizing the cycles and improving the overall quality of the ovarian environment, but they are just add-ons. They are not the 100% treatments. They are just add-ons.
All right. So I keep saying this last question, but I see some question and I come back with the last question, ma'am. Please pardon me. Ashish Chauhan is asking how to reduce LH in PCOD. Please answer. And that's a seriously last question.
Yes, so that is only with exercise and diet changes, weight reduction.
Great. I'm glad you didn't say there are medications for it. It's in your hands, Ashish ji. Please go ahead, take the women in your life out for exercise. Thank you, Mithee Bhanot ji. It was wonderful having you here with such great patience that you had answered all these questions. So it's no amount of reiteration will be enough to reiterate the exercise and lifestyle changes. I would want you to give us top tips to manage PCOD.
So the top 3 tips are for managing PCOD. The first is follow a strict exercise regime and stick to it, no matter what. Stick to your exercise regime. That really helps in controlling. The second is shift to a healthy, balanced diet with more of freshly cooked vegetables and food of different colors and local cuisine, the local food of your area. That is the best to control the polycystic ovaries. And the third is have a positive attitude. In case your exercise and your lifestyle changing is not helping you, please consult a doctor on time. Please consult a gynecologist on time so that we can help you with your polycystic ovaries.
Wonderful, ma'am. Thank you so much. And I hope women take a call on their health and they take an action to control their health. Thank you for being with us on this Sunday morning. Namaste.
My pleasure. Namaste.
So that is Dr. Mithee Bhanot, who answered all your questions with such patience. And now, answer my questions. I'm asking you 3 questions in health quiz. You have to answer the questions over YouTube chat only. Winner's name will be announced at the end of the show and winners will be declared at the sole discretion of Apollo 24/7. And you have to write back to us at marketing@apollo247.com. Gift vouchers will be shared with you. All right, here are the 3 questions for today in health quiz. What is the difference between PCOD and PCOS? Please mention the D and S. That's enough. Don't give me a full page answer. The D and S, वो आप मुझे difference बता दीजिए. What is the difference between PCOD and PCOS? When is International Day? This is question number 2. When is International Day of Action for Women's Health in 2022? It is already celebrated. It is already observed. So we've passed the date. That's a tip. And question number 3, where can you find your test reports in Apollo 24/7 app? In Apollo 24/7 app, where do you find your test reports? Which tab do you find? So these are the 3 questions. Keep your answers coming. And I'm seeing that there are a lot of people who are asking. D is disease and Shravya, and a lot of people are answering. Go ahead, keep answering. In the meanwhile, let me give you out the coupons for today. The first one that we are giving out is First We See. Use this code First We See to get doctor consultations direct from Apollo and get 150 rupees off on the first online consultation. Use this on Apollo 24/7. The code is First We See, where you get 150 rupees off on the first online consultation. And the next one we are going to give out is First 3. Direct from Apollo app order medicines order कीजिए, get 25% off on the online medicine orders. Use the code FIRST3. This can be used only on Apollo 24/7 app. Download the app and use these coupons. And for our Health Hour viewers, you've been there for watching this show and your questions made a lot of difference. So this is exclusively for Health Hour viewers. Use this code HH247 and get 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders. You can use this on Apollo 24/7. Download the app right away. And today's winners are Shravya Nagila, Dhanlakshmi and Rakshak AR. Congratulations. Please write back to us at marketing@apollo247.com to claim your gift vouchers. All right. Thank you so much for joining us today. Next week, we are bringing you an interesting topic, which is benign and malignant brain tumors. Very important discussion. Tune in to Health Hour, 5th of June, 11 a.m. And if you don't want to miss any of these shows, subscribe to Apollo 24/7's YouTube channel and you will not miss any of these interesting discussions. Thank you once again, all of you, for joining us and asking your questions, and you make a lot of difference. Thank you. Namaste.